Good morning to everybody. I'm Teresa Comstock. I'm Executive Director for California Association of Local Behavioral Health Boards and Commissions. We're going to talk about how to be an effective member of a behavioral health advisory board or commission, which means how can we be effective together as a team on these advisory bodies. And this is meant for both the members and staff because we know that their support really helps for us to do our work. So we'll talk about membership, meeting rules, duties, and tools. We'll talk more in depth a little bit about the Behavioral Health Services Act, and then also some suggested ways to review and evaluate. Let me check my camera. I just want to see if it looks okay right now. Just a second. Let me do a spot right. We can see it up here also, so it might be your computer if you're having any issues. Okay. All right, so the first item here is membership. We have complicated membership. And these are state requirements. It's in California law, these requirements. In the best practices manual that the folks in the room have, the last 2 pages of the manual is a summary of the membership requirements. And the pages before that are the full California law. So I just want to call your attention to these pages, just so you can check back with, make sure that you're in alignment with these pages. The items on this slide will tell you, the summary also, but a little bit more detail in the binders because there are some allowances and exceptions. So the first is 3-year terms. People are appointed to 3-year terms and then it's over. They don't continue on because nobody else was appointed. That's it. It's three-year terms. They could be reappointed, but it needs to be done by the Board of Supervisors. They appoint, or if it's a couple of the jurisdictions, it might be city council members that appoint. 10-member minimum for most counties. And if it's a county that's population 80,000 or less, then it's a 5-member minimum. 50% must either be consumers or family members of consumers. And consumers are people that have either in the past or are currently receiving services. It doesn't have to be services of a public agency, just services related to mental health or substance use. One person of that 50% must be at least 25 years of age or younger. And also, there must be a minimum of 20% consumers and 20% family members. So, we can go above that. You could have more, that's fine. You could have people that have multiple categories. They could be the Board of Supervisor member. They could have, or they could also be consumer. They could be a veteran. They could be an employee from a local education agency. So they could fit all of these different categories. So like I just said, there must be a Board of Supervisor member. There must be an employee from a local education agency. That could be anybody that works for the education agency, but they do need to be an employee So it could be a counselor, a teacher, a janitor. Probably that wouldn't be the right fit, but it would probably be, you know, people that work with the kids would be a good fit. The veteran or veteran advocate can be even just a family member of a veteran. It's a pretty loose definition of veteran advocate. And then you must reflect the diversity of the local client population as much as possible. So when you look around the room, you want to see people around the table on the board or commission that represent the people that are being served within the county. And then the law goes on to encourage that the boards or commissions have people with experience and knowledge of the mental health system. And they list several examples, but this is not a must. It's good if you do this. You know, it's great to have people that are working in sectors that interact or have, you know, retired from sectors that interact with mental health and substance use. There are exceptions in terms of if somebody has, somebody is a consumer, they may be a contractor. And that's the only people that can be a contractor, or actually they could be an employee also of the behavioral health agency. But you have to be really careful with that one. If they're a contractor or if they work as an employee of the behavioral health agency, they cannot be involved with overseeing contracts or fiscal matters. So you wouldn't want like the executive director of a nonprofit to be on your board. Even if they are a consumer, it's not okay. And you wouldn't want somebody that's administering contracts for the county to be on your board. Okay. All right. So meeting rules, we're going to talk about this more later this afternoon in the chair and administrator training. If we could do just a short overview right now within the binders here in the room and on the training page, there are Brown Act guides that we've put together for the boards and commissions. I think somebody's sound is on. And we just provide to you a summary of some of the basics, frequently asked questions, and the allowances currently. Yesterday, many of you might have listened in when I talked about what was just put into law with the Brown Act and will actually take effect in January with, we think, and we're going to review this and make sure it's correct and then get communications out to you. But it looks like if the Board of Supervisors allows it, you will be able to attend by teleconference without posting your addresses. So there is a change that will be implemented in the Brown Act guide. But, you know, just basics are, you want to be a board that's open to the public. You want to be that avenue that they can come and they can express what their needs are, what their concerns are, what they want for the county. You need to be there to ensure that their voice is heard. And you don't want to be doing anything that would be considered a meeting within the Brown Act, which means you don't want a quorum of your members, which is a majority. So one more than half of your membership should not be in conversation about behavioral health issues unless you're in a meeting that's been posted, you know, that's open to the public. Okay. And most of your meetings, they need to have agendas posted 72 hours in advance on the county website. And the posting should be also outside the building where the public can see it. So when they come to the meeting, they know where the meeting's going to be. So those are some of the main things that I wanted to express this morning. And then a little later, when we do the chair and administrator training, we'll talk more about the Brown Act. But the new law that was just signed will require boards and commission members to all get a copy of the Brown Act law, which is very long. So we'll encourage you to take a look at our Brown Act guide so you can see the summary that's pertinent to you. All right, let's talk about conduct. Oh, yeah, question. Let's get a microphone.
Thank you for mentioning the Brown Act. Is that something that is available as hard copy or PDF, and should copies be made for each meeting, or because we might have new public who would attend a meeting, or in the commissioners, I can understand we get one copy and we should be able to hold on to that. So I just didn't know the format that it comes.
Yeah, the law just says the members that are appointed need to have copies.
Okay.
And yeah, PDF, it's online. I think
Right.
you can print it as a PDF or make it into one. Yeah, but it may be, you know, also the county should be involved in that and making sure that they provide that when they appoint people. Thank you. Okay. So the conduct list, it evolved over time based on what's happening, you know, on boards and commissions. We want people to have good discussions and stay on topic in terms of talking about behavioral health issues, listening to staff, listening to each other, listening to the public. So that's why this list came about. That's not always the case, and we don't want people to go the other direction where they're not being civil with each other, they're not listening to each other. So the first one on this list is active listening. To us, that means listen, listen, listen. Don't start thinking about your response while somebody's talking. Just try to take in what they're saying. So listen to each other, listen to the public, listen to your speakers. If you do have some responses or questions, you might, you know, note them and wait. If there's time during the meeting, then you would, you know, ask your questions or make your remarks and comments. But know that you will have multiple meetings. You'll keep meeting and meeting and meeting, and you can strategize on how you want to work on a certain issue at a later meeting. So, you know, you take in the information, think about it, and then think about what kind of strategies you could use in order to take action on an item if you think that it's important. So we don't want people, you know, thinking that they need to react in the moment when something is said. We want people to stop, take it in, and then maybe react in the future if it becomes a priority area. Okay. Focus on issues. So that means focus on behavioral health issues, you know, related to needs and related to the performance. The next item is person first language. People that have mental illness or substance use conditions are many, many things. And that might be one thing that they've had or they currently have or have had in the past. That doesn't define them. So we need to use person first language, such as an individual with bipolar disorder, a person with mental illness, people with mental illness. So we don't say the schizophrenic or the mentally ill. That doesn't respect that they are people and they have a lot of aspects to themselves. So we don't define them with one category. No swearing, if possible. Sometimes people do that on a regular basis. So do your best not to swear. No personal attacks or criticism of yourself or others. And again, number one and number two, active listening and focus on issues. We don't want you to get personal. When I sometimes get support calls from chairs or others in counties, it's sometimes related to that. And it brings them away from the work of the Border Commission when they get personal. Even if somebody's gotten personal with them, do not react that way. Just react with silence and think about issues and think about listening. One person speaks at a time, no sidebars, not even whispering next to each other during a meeting. Keep comments short if possible, do not monopolize. Limit acronyms. Just about everything needs to be said. And, the Behavioral Health Services Act is new to a lot of people. BHSA, over time, people understand that's what that acronym is, but people will be coming on the board, there will be public members. Anything that is an acronym really should be spelled out. And silent cell phones if possible. Sometimes people do need to check their phones, but it is very distracting for speakers and others, especially if people are looking at their phone, when the public speaks, or if it's somebody that has come as a speaker to present to you, that's not the time to be checking your cell phone. And it's also not, if there's somebody on your Border Commission that you think maybe they're doing some of these things, they're monopolizing, they're doing personal attacks, that's not the time to look at your cell phone either. And we don't want you texting each other during the meetings. I'm looking at some people that I think might do that, so. All right, so let's move on. Were there any questions about conduct before I move on? All right, so review and evaluate the community's public behavioral health needs, services, facilities, and special problems in any facility. That includes jails. But this is the California law. That doesn't mean that the jails will let you do this. In any facility within the county or jurisdiction where mental health or substance use disorder evaluations or services are being provided. So that's your number one duty. And we have some suggested tools for this. Many of them you've probably used in the past, having speakers, pulling together panels of speakers. So say you have a topic such as school-based mental health. You might have people from a school or schools. You might have young people. You might have people that work with the kids. You might have people from the County Office of Education. You might have folks that work with children and youth that work for the Behavioral Health Agency or are a contractor for the Behavioral Health Agency, and pull them all together into a room and allow each of them a chance to speak on that topic. And then that way you're not only like breaking down some of the silos, but people are more accountable when they say things instead of pointing fingers at other agencies when there are barriers and challenges. There's usually more collaboration and cooperation, and you'll have probably more information that comes your way. And that kind of panel can draw people to your meetings, so you will get people in the public that are interested. Liaisons to commissions and committees that are in your community. So if you have a specific area that you are concerned about, such as maybe it's housing, you could have a member of your border commission attend those commission meetings and report back to you. And if there are things that you have made recommendations on related to their work, you could provide that information to them. Site visits, and there's a guide in the best practices handbook and also on our website under resources. We have a suggested form to use, a suggested process in terms of just how to set up the site visits and how to conduct them. We find that to be a good tool. It's good to be on the same page with other members. Usually it's 2 or 3 members that might do a site visit together, certainly less than a quorum. And they would need, to be on the same page in terms of what they're looking at within the facility, what they're checking about, and what kind of questions they'll ask staff. We recommend that, not only that would they get a tour of the facility, but they get a chance to sit down with staff and ask some questions. And if possible, sometimes just during a tour, you get a chance to talk just, in the moment with people that are receiving services at that facility. Ad hoc committees. An ad hoc is a short-term work group. It needs to be less than a quorum of members. It doesn't have to abide by the Brown Act as long as it stays within being short-term, less than a quorum of the board or commission. It must be less than a quorum of specific committees too. And like the executive committee, any committee that meets regularly, they are subject to the Brown Act too. So an ad hoc committee is usually, 2 or 3 people. They will determine what is their objective, what are they trying to find out or do. Maybe it's just that they need to do an annual report, and you don't need to do anything formal about that. That's something that happens every year, and you'll have a couple people and they'll just work on the annual report together. But we have a guide for if it's something that's outside of your normal schedule of topics, you would be better off having folks write down on the form and submit it to the executive committee what their schedule is, what kind of activities they're going to do. Maybe it's they'll have meetings with certain people. Maybe it's they'll review certain documents, and maybe it's they'll come up with a recommendation or an issue brief on that topic. So we have those types of guides within our best practices document and on our website. You can ask.
So you mentioned the ad hoc committees. Do you have any suggestions for standing committees other than the executive committee?
Okay.
Somewhere along the line.
Yeah. The question is a good one, because some of the boards and commissions have a lot of standing committees. For the most part, I haven't seen boards that have a lot of standing committees have good attendance or quorums at their standing committee meetings. It usually doesn't work well to have a lot of standing committees because we're dealing with all volunteers almost, except for the board of supervisor member. Everybody's serving as a volunteer on this board. They've been appointed, but still they have other things usually, and they can't do that many meetings. That's more than what they thought they signed up for. So it's usually better to, I think a lot of times it's good to have an executive committee in very small counties. It doesn't usually happen, and that's okay. But the other committees usually are maybe a vehicle for staff to present more information outside of meetings, and that's okay if the staff wants these types of meetings to happen. And staff can provide these type of meetings without you having that be a standing committee. They could, they could have children and youth meetings every, 2 months or something, and invite you to come, and you could have liaisons come to that, instead of having a children and youth standing committee that has to abide by the Brown Act and post their agendas and that sort of thing. Is there a question in the room? Yeah. Oh, yeah.
Well, our bylaws, excuse me, in our bylaws, we have standing committees already. And I suppose we could change it, but we are, just for, what you're sharing, attendance is minimal, especially from commissioners. And even for leadership purposes, finding chairs and co-chairs. So we are, but so my understanding it was, I guess it's our bylaws that dictate the committees that we
Okay.
get to form. But my point is that in this season, I'm in my third term, so I know that in the past they've been thriving, but in this particular season, it really, yeah, there's, and we're just kind of wondering, do we, is it a matter of, and I guess it'll be another time to talk about kind of like commissioner engagement and
Right.
collaboration, how we strengthen that, because I think that that's part of it as well. They feel right now that the burden is heavy in terms of, and I guess we could look at when we meet, because right now all three committees meet on a Wednesday, the same third Wednesday of the month. But anyhow, I'm just responding because, yeah, so we get, if we find as a commission that it's a challenge, maybe we can look at changing the bylaws to shift the
Right.
committees.
Right.
Okay.
Right, yes, you can change the bylaws to change that. And, I would say work with staff too, because maybe they were involved also asking, originally years ago, asking for you to have these standing committees. But it's not required, they can have their meetings. They don't have to have it posted, but once it becomes a standing committee, it has to be posted, and you have to, if you want to make any decisions, you need to have a quorum.
And that's just what I was going to emphasize, is one of the barriers to standing committees is that compliance with the Brown Act, because it gets very burdensome to have all this published 72 hours in advance, open to the public, et cetera, for a bunch of different kinds of committees.
Yeah, do you have a, okay, one more question in the room.
Thank you, Stacy Dalglish, LA County. I just want to confirm with you, Teresa, that if you are going to form an ad hoc, that it's something that needs to go to the larger commission and then they vote on it, because that's the way it's been done for us. We don't, so I could just decide and pull in some people who I know are interested in dealing with the same issue.
Well, we suggest that you go to your executive committee,
Okay.
like I said, we have a form, just to
Right.
just to make sure that people are on the same page. They know it's short term. They know if there needs to be some type of objectives to this, just to help them have that structure. I
Okay,
think, and then the executive committee could approve it. That's not in law that would happen. It's just a suggested practice, just
Thank
to
you.
make it, a vehicle of the Border Commission. You might check your bylaws. Maybe there's something in the bylaws that require you to approve an ad hoc, but it's not likely that you've done that. Hopefully you haven't.
Teresa,
Yeah.
I was going to mention in San Diego, every year we have a retreat for all the behavioral health board members, and the staff comes. So we discuss our goals for the year, but also the ad hocs. So we usually change them. Either we change the name, but depending on the season, like she mentioned, we change our ad hocs too. So everyone's there and has a say so, but the executive committee's there. And that seems to work for us. Well, how I'm using it is, each year, there's a different, general focus. And let's say, for example, hypothetically, if the focus for the state changes as far as financial money given to the county and what's going on in our county, there's a heightened focus on, let's say, criminal justice, where it needs, we feel as a county or as a behavioral health board, we want to focus on that. That's, well, criminal justice is usually not seasonal because we tend to focus on that a lot. But yeah, certain things are, yeah.
It could be, it's a good question, and it's good that you asked about seasons, because I think, it is good at least once a year to just ask your board members, what are the priority issues? Just try to determine what that is. That could be the priority issue season. Okay.
Put that out, that sort of planning time also work to determine if you need standing committees, of what type.
I would say during that planning time, you might just want to identify priorities, and then your executive committee could determine what kind of tools you want to use in order to address those priority issues.
Okay. So the point is then to take it back to executive
Right.
to make that decision.
Or the chair, it depends on who you have on the board. Sometimes it's just, the chair can kind of move things forward and get folks to step up to help with an ad hoc.
Now, when you mention the word staff, are you referring to like a clerk or staff? You said take it to the staff might do this, or in terms of the committees, like the ad hoc committee or staff might.
Yeah, if I said staff, I misspoke. Yeah. So the chair
The
could
chair.
be the one that determines, that's when I've chaired different things. I just look for who are the active members, what are their interests, and I'll sit down and have coffee with them and talk to them about that topic and ask them to run an ad hoc or ask them to move forward with something. Once I've learned their interest and created that relationship, that usually they'll say yes. But you don't want to just throw out a question in a meeting. You might not get the talent that you need, and you wouldn't always get the buy-in either. Okay. And then the last item on this list is performance outcome data. So looking at the performance of the different programs is an important way to review and evaluate. So the next item is review any county agreement. And this one gets into government code. It says, review any county agreement entered into pursuant to section 5650. 5650 refers to an agreement that your behavioral health director signs off on for your county in order to receive certain funds, a lot of funds. And so within that agreement, they are signing off that they are consulting you on behavioral health services. So you need to not only exist, you need to be able to have meetings where there's some interaction with the behavioral health director and they're able to, not only present information to you, but get feedback from you. So strategies to review these contracts. So there are lots of contracts that come out of these big agreements with the state. So the county's gonna, and a lot of counties have 40 or more contractors, even if they're a small county, thousands of contractors if they're a large county. So those kinds of contracts are things that you can look at. And then you can also look at things from a system level through information like the Medi-Cal external quality review organization reports. It's the EQRO reports. And those have some data. It's usually related to access. You can see the penetration rates for different racial, cultural groups. And so you can see, are they even accessing services? And then in terms of performance, you can see only data on hospitalization really right now is related to performance. You can see if people are being re-hospitalized. So if they've gone into hospitalization 7 days out or 30 days out, it has the data if they returned. So you get an idea of, you know, do we have a behavioral health continuum, or do we have people just cycling through, going in and out of hospitalization? Liza?
Good morning, thank you. And you can tell me if this doesn't apply at all. I just have a question because prior to going to a site visit, I asked for the contracts and they were unattainable. And the only reason I asked for the contract was because during our site visit, we honored the request that we were not allowed to look at everything in the facility. We could only go to one office and talk to those people. And so I wanted to look at a contract to see what part of behavioral services was funded. Was their programs funded? Was their gym funded? Was their kitchen funded? But we didn't get to see any of that because the agreement with our clerk and the site visit was that we had limited access. And so I wanted to see the contracts to find out what, and I'm just curious, is, you know, not to be aggressive or anything like that. Of course, we're going to accommodate them. I'm just wondering what a thorough site investigation site visit actually entails when it does have multiple moving parts, like 100 people in the kitchen working who are also clients, or if there's an art room or a facility. They're not allowing us to view those. And I was just curious if that's just normal protocol or if it is okay not to see the contracts. I'm just wondering what the proper protocol is moving forward.
So the contracts are part of what I'm going through here. You know, they're part of the duty number 2, and they are usually public documents. You could even search on the internet and see what kind of county agreements have been signed by the Board of Supervisors. So it's fine to look through them. I would say it's not necessary for you to be looking at the budget for the kitchen unless it's something that's part of their services, you know, because there are some that do, you know, it's peer run kitchen, you know, it's something that's related to employment. And the area of the contract that I would recommend looking at, it's usually 1 or 2 pages. It's the deliverables. It is what are the deliverables of that agency, so you understand before you go in what, you know, what to expect from the services that you see. And it gives you a better idea, you know, as you're going through the questions on your site observation form of you know, who you're talking to.
So in San Francisco and Commissioner Morowski, this is Commissioner Stevens. I'm not sure who you asked for the contract, but normally it should be available through the Behavioral Health Services Department for our commission members.
I did ask, and unfortunately, we're in San Francisco. So as we know, there's multiple people in a contract. And so you have to really look at it. And unfortunately, a lot of times the contracts are not updated. And especially with the Proposition 1 and changing everything. And I just think it is kind of strange that if we're going to a facility and the individuals in recovery are utilizing the kitchen, I think it's really important, if that's part of behavioral health services and recovery and everything, that part of the program is actually functioning and healthy and operative. I just think those are key elements to recovery institutions and recovery homes and shelters, that they're operating completely. And it's just not always very clear in the contracts that I pulled up. So when I requested the updated contracts, I didn't get them. So I'm just looking at protocols and what is right and what's not right. And like, does it really matter? I mean, that's all. It's not a big, huge question. I just don't think the contracts in San Francisco are completely updated.
And yeah, for most counties, that you'll have a staff liaison for your board or commission. You might ask them, or the in some of the smaller counties, the behavioral health director also helps to connect you with staff. And it's usually like the chair would reach out, or if somebody has permission, then that individual could reach out specifically to staff. All right, let's move on to the next item. Duty number 3 is advise the Board of Supervisors and the local behavioral health director regarding any aspect of the local behavioral health program. Usually I see recommendations going to the behavioral health director. Occasionally it's the Board of Supervisors. And oftentimes with the Board of Supervisors, when you advise them, it's something that's outside of the range of the behavioral health agency. They, like San Francisco, they had recommended putting some netting near one of the bridges. I don't know if it was the Golden Gate Bridge or the Bay Bridge. Golden Gate. And it took them years of providing these recommendations to the Board of Supervisors, and finally they acted on it, and they did that. So there are specific items that you might go directly to the Board of Supervisors. Oftentimes it is the behavioral health director, though, that you're advising and working with closely. Identify the topic is our suggestion first. And how do you identify what you should advise about? There are 30 or more different areas that you could go in terms of advising, right? So you have to be, listening to public comment, looking at performance outcome data, listening to presentations from your staff. And it's great to invite patients' rights advocates and contractors also to present to you, and also liaisons to have with other boards and commissions within your county, or other committees, or even committees within the behavioral health agency. These are great ways to identify topics that you would want to advise on. And then research. You could use an ad hoc committee to conduct research meetings. And like I said before, we have information on how to do that. The chair can meet with the behavioral health director. Usually what that looks like is if there's an executive committee, the behavioral health director may attend those executive committee meetings. Or, the behavioral health director usually, not sure always with LA County, but I think usually the behavioral health director would be at the commission meetings or the board meetings that occur monthly also. And then site visits are a good way to research. If, say, the public has come to you about a certain site that they've had an experience with, or their family member has had an experience with, If it's not something that's subject, they say, to a lawsuit because of that experience, you know, if it's just that you're curious about it, you'd like to learn more, that might be a reason to do a site visit. Or if it's a topic that you've determined is a priority issue for your board or commission for that year, say it's looking at board and cares that your county contracts with, that would be a reason to choose that. And then advise, so draft your recommendations. Usually that would mean a member or an ad hoc group would draft recommendations, and then the executive committee would review that. And possibly, if they agree to put it on the agenda for the board or commission meeting, they could do that. And then it could be reviewed by the board or commission. And if it's supported by the board and commission members, then it can become a vehicle that they use to make recommendations. So that way they're working together as a team, you know, giving them the opportunity to approve the recommendation or approve the report if it's maybe an issue brief or a report that's come out of the research. Oh, and I'll say also, you know, within your annual report is a great place to put these recommendations. All right, so the next item is review and approve procedures used to ensure citizen and professional involvement at all stages of the planning process. So I'm going to pause here and pull up another PowerPoint that's specifically on community planning requirements, because this is such a big topic. So this PowerPoint, which is in the materials for the training that I shared the links with you, this will describe to you philosophy, principles, and practice requirements of the Behavioral Health Services Act for the integrated plans. And keep in mind, these integrated plans are integrating with everything. So all the funding sources and all the other systems in place are considered within these plans. And so I'll talk a little bit about the philosophy, principles, and practice requirements, the funding that's available for planning, and the behavioral health agency, the staff requirements and tools that they have. So you understand, you know, they're doing the heavy lifting, but you need to understand what they're doing and make sure they're, you know, they're reporting to you so you are comfortable that it's happening and you can interact with them to help them get into areas that they may not have access to in order to more meaningfully engage with different stakeholders through planning processes. And then the board and commission requirements in terms of membership, which I've already reviewed with you, but also duties. And then we also have toolkits that are available to different groups, including boards and commissions, but just to help the community understand how to engage in the planning process and be a part of it to inform the system, whether that means the next Behavioral Health Services Act integrated plan is changed by that input, or maybe a few years down the road, that plan will be changed, or those considerations might even come to the attention of your board and commission, and you might make recommendations for those. So philosophy, principles, and practice requirements. Recovery vision is required within these principles, and that we would be person-centered, number one. Secondly, promote consumer-operated services. Third, reflect cultural, ethnic, and racial diversity and address inequities. And then fourth, to plan for each consumer's individual needs. The funding that's available is up to 5% of total Behavioral Health Services Act annual revenue. So quite a bit of funding can be provided. That means the staff could hire people onto staff that are really just focused on doing planning activities, especially in small or medium to large counties. The smaller counties, they usually are a little bit less in terms of how robust they can do just because they don't have as much staff, but they can still allocate up to 5% if they want. So that's even substantial for a small county. And this should pay for the costs of consumers, family members, and other stakeholders to participate in the planning process. So that could even mean that the county might contract with some of the community-based organizations to help them with community planning, just to help be that conduit to the community, to help engage and do some outreach and get the information that they need and the connections that they need into those communities to help them build the next plan.
What the BHS annual funding is somewhat a question. If you think it's only the old MHSA rolled over funds, the 30 million we get in Sonoma County, 5% of that is a figure. But if you think the plan, the integrated plan is supposed to mean that BHSA planning is opioid realignment, Measure O,
Yeah, let
there's,
me stop you there.
okay, so what is
Yeah,
the
so
annual funding?
And of the Behavioral Health Services Act
Only.
funding, yeah, that comes from the state.
Okay.
And that is substantive though in
Oh,
itself.
sure.
That's usually about 30% maybe, or 25%, 25 to 30% of the total behavioral health budget.
Okay.
Sure. The local agency has specific cultural competence requirements. This term cultural competence has been, it's in question right now. There was a recent executive order on the federal level saying that we should not use federal funding for cultural competence, but there are federal requirements for cultural competence. So I just wanted to call your attention to that. But so this is what we still have in place in terms of the counties have requirements to do cultural competence plans, which means they need to commit to assessing service needs, creating strategies and efforts to reduce disparities, all these different activities that would decrease the disparities in terms of certain races, cultures, ethnicities, and language capacity is even part of that. So these are still federal requirements, even though we're not supposed to use the term cultural competence. The local agency staff requirements includes the behavioral health director's requirement. I mentioned this earlier. They are required, and I put this in highlighted text. They are required to recommend to the governing body, usually that's the Board of Supervisors, after consultation with the advisory board. So they should be consulting with you before they recommend anything to the Board of Supervisors. Okay, so just want to make sure that you're aware that this is in code. It's on the agreements that they sign, that they should be in consultation with you. Meaningful stakeholder involvement. Now we put meaningful in italics just to emphasize the word meaningful. If you're going to have 29 stakeholder categories that are required by law now to be consulted through the planning process when a Behavioral Health Services Act integrated plan is being worked on, for the planning, the stakeholder involvement will not be meaningful if that means you're just having big meetings and just inviting all these different groups. That's not going to be meaningful for a lot of those groups. So we want you to just be aware of this requirement for staff. They have to be engaging in a meaningful way throughout the planning process with these 29 different stakeholder groups. And part of your job, remember, I just switched over from that other PowerPoint. You're supposed to be ensuring that there are procedures in place that allow the stakeholders to be part of these planning processes. So those procedures are things that you need to be able to review. You want to get some presentations from staff. You want to know from them, what tools are you using? What kind of schedule do you have? Are there any meetings that are open to the public that our board members could be attending, just so we can be present and listen to the public at those? That sort of thing that they could be presenting or providing updates on. And then this next slide and this slide after provides some tools. So we want people to get away from thinking one big meeting. We don't, sure, you can have some big meetings. That's fine for community planning, and you can get some input and that works sometimes. But there are many, many ways to have community planning. And so I'll go briefly through this. Education and engagement. These are all in the policy manual from Department of Healthcare Services, so all suggested by them. Listening sessions, and Cal BHBC, our organization, has a toolkit that we recommend for meaningful listening sessions. Conference calls, client advisory meetings, consumer and family group meetings, town hall meetings, video conferences, media announcements, targeted outreach, public comment, and that can include public comment at your meetings, public hearings, stakeholder work groups and committees. A lot of the counties have cultural committees, and they also have quality improvement committees. Some of them have other committees. They may have committees, related to children and youth services. Sometimes that's a standing committee of your own board or commission, but sometimes it's just run by the county. Focus groups, surveys, key informant interviews or engaging with subject matter experts, training, education, and outreach, and then other strategies. So a lot of different ways to engage with different stakeholders. And, before I move on, I just want to say, part of the issue with behavioral health is that we want to get to people that have been traditionally unserved or underserved. And if you're going to be, considering their voice in your planning efforts, it's important to reach outside of your normal circles, or the staff needs to reach outside of their normal circles and find tools that would engage them in those conversations.
Stacy Dalgleish. I've been involved in most of these tools, but one that I haven't, and I would like for you to discuss the Brown Act issues related to this, are conference calls. What are you thinking of when you say conference calls here, and what would be the requirements for me if I were to use that?
Right, yeah, this list was compiled by DHCS. I think, a conference call, sometimes people think of even a Zoom call, it could be a conference call.
Okay.
Some of the counties still have conference phones where it's just voice, it's just audio.
Okay, thank you.
Sure.
Also, when I mentioned when it had the media announcement in San Diego County, a lot of times we would think of just TV advertisement, social media, but our county did a survey and used billboards, like billboards around the city, big, huge ones, and they found it more effective where it was accessible to many people. Homeless and it just worked out really good, but we didn't think about it as a behavioral health board. And through different conversations and understanding the cost effectiveness, it was used last year and it turned out to be a very positive and reached out to a lot of people. That was a good idea that didn't pop into our heads at the beginning. So I wanted to share that.
All right, I'll stop there for the community planning requirements. And I'm gonna go back to the other presentation that we had.
If I can just clarify, because that goes under the heading of media announcements, like using billboards. It's part of that whole umbrella of media announcements.
Linda, go ahead.
Hi, good morning. As you know, Orange County is having a little bit of discussion regarding whether or not the board should be approving the procedures for the community planning process. And the position that the county is taking is that the recommendations for implementation of BHSA have some new guidelines that the WIC code has not updated. And the WIC code should be updated to reflect that the behavioral health boards no longer have that responsibility. It's putting us in kind of an in-between. So I was really curious as to how you would approach it today. And it looks like, if I'm understanding correctly, that you're still abiding by the current WIC code, what the current WIC code says, even if it hasn't been updated to match the recommendations from DHSA for implementation of BHSA.
It sounds like
So, Carissa.
I just want to stop you because a couple of times it's not true. The Welfare and Institution Code for boards and commissions was updated when the Behavioral Health Services Act was updated into law with Proposition 1 and SB 326. And I have spoken with your chair and gone back and forth and your behavioral health director. And I think that they understand that part of the policy manual is on boards and commissions, but it's later in the policy manual, and your Behavioral Health Services Act coordinator, I guess, or manager did not look at what I say is probably page 15. So they jump to a different area for some of the requirements for the boards and commissions. And it is in there. And our boards and commissions are not regulated by the Department of Healthcare Services or their policy manual. We have things in law that are specific to our boards, commissions, and that includes reviewing and approving procedures for planning, and that continues.
And should that be a formal process? Should that be a vote indicated in the minutes that that approval has occurred?
That you can do that. I haven't seen boards and commissions take this on in that way very often. Sometimes they do. This has been, sometimes I think, well, maybe in the past, maybe it was 50 years ago, that they approved the planning procedures. But it depends on the county and how their staff provides the information. And it depends on the leadership of the Board or Commission if they want to do a really formal process of this, or if they just want, they want to have that kind of update from staff and review it and comment on it. I think a lot of the boards and commissions, that's been the way that it's been happening, and that's okay. This doesn't say they must do it annually. It just says, they just want you to ensure the citizen and professional involvement. So reviewing and approving, it might be just a quiet approval, but it's just being engaged in that conversation with the staff and making sure that these planning processes are taking place, and that, I mean, I think that the boards and commissions are a great resource for the agency when they are providing these types of updates to you. They can get feedback that's really good, and you could actually, if you are a diverse board that represents the community, you could help them connect into some of the areas where they have difficulty with your recommendations.
Thank you.
Teresa? I just wanted to build, Christine Hatia from Napa County. I just wanted to build on what Bill was saying about billboards. It's not being used for the planning process in Napa, but our Suicide Prevention Council has been doing transit advertising. So they have ads on the buses as they go, talking about the suicide prevention and the 988 number and all of that stuff. And one thing I like about that is that the buses go to places where people don't necessarily have cars, so they actually reach some of the other, some of the people that are not normally reached by the system. So that's just another idea for how we can do media advertising for, if there are public meetings about BHSA or something.
All right, thanks. Let's move to the next item, submit an annual report. So this is a good vehicle for you to be providing the recommendations that you've made. If you've made recommendations throughout the year, then list them in your annual report. On this slide, we underlined needs and performance. So just want to make sure that's included, that you've put together a report that that talks about some of the needs assessments or priority issues that you've identified that you're working on, and then and you're working on, making recommendations toward it, or you could even highlight some of the accomplishments of the agency. And then performance, talking about what the performance of the system is so important. And I think we've had some data in some counties that help us understand the performance of certain types of programs. And I'll talk about that a little bit more, but performance performance information will be increasing over the next few years. That's one of the accountability pieces that was built into the Behavioral Health Services Act. And we're still in the midst, the state is in the midst of identifying what will be required in order to meet that statute and make sure that we're getting, performance information for behavioral health services. And right now it looks rambling and big. I'm part of the committee to determine what those performance outcome measures will be. But it's not finalized yet, and we'll see what happens with that. Hopefully it'll be something that the counties can implement, that it's not too many different points of data that they have to collect and their contractors have to collect. But it's so important to understand how are the behavioral health services meeting the needs or not meeting the needs of individuals in our communities? And what's the life impact?
Teresa, does that website link contain annual reports from a variety of counties? I mean,
Yes, yeah.
thank you.
6 is review and make recommendations on applicants for the appointment of local behavioral health director. So you should be part of the process if there's a vacancy in your county for behavioral health director. This is not something that staff always knows about. They don't always know your duties. So you know, in the case that there's a vacancy or somebody announces that they're retiring or resigning, then it's good to be in conversation with the, you know, the interim behavioral health director, make sure they know that your board or commission should be provided that opportunity, maybe to review applications, review the job description, review applications, and be there. Maybe it would just be a couple of your members could be part of the interview panel. And then next item is review and comment on the county's performance outcome data and communicate your findings to the California Behavioral Health Planning Council. The Planning Council over the years has been asking for a survey that they call the Data Notebook. And we have been advocating that they focus on performance in those data notebooks. They've focused on lots of topics. And I think they're important topics that they ask questions about. This current one is on the topic of wellness centers, and hopefully your boards and commissions have seen the data notebook. Not yet? Okay.
Next month.
Next month? Okay. And it's due November 15th. If you're late, they'll be okay with receiving it though, I think.
Has it come out, the requests come out already?
Yes. You need to get yours? Yeah, well, and you just email me if you don't know about the data notebook, you have, or if your county hasn't received it, and I can connect you with them. Then our association has done a lot of work to advocate for performance outcome data to the state, since that this is your duty, you know, you're supposed to be commenting on it, so we need to see it. So we have an issue brief on performance outcome data, and we've been compiling information from your counties just by looking through your behavioral or Mental Health Services Act plans and updates. We look for that information, and then we also look into the Medi-Cal external quality review information reports that are annual for information, and put that on our website. This is just kind of a preview of the website and what we have on it. So there's a page for every single county, so you can click on your county and see what we've collected. We have different categories that we've seen the most performance outcome data provided, and those include performance related to children and youth. So children and youth that are receiving services, sometimes it's information about improvements in attendance, behavior in the classroom, self-reported behavior or behavior reported by the teachers or parents, and then assessments also. And then criminal justice, usually that's data related to reduction in arrests, reduction in the number of days that they've been incarcerated. Employment, usually there's data regarding people that have stable, competitive employment. If in all the counties, because of the Behavioral Health Services Act, will be providing vocational services in the future. So we'll see more and more employment data also. We see employment as a major therapeutic tool and a major part of wellness. hospitalization and rehospitalization information, and then housing. So on our website, on the performance tab, you can get to your own counties. Yeah, there's a question in the room.
Actually, not a question. I want to speak to the EQRO. This year, the organization that is doing the EQRO changed. The organization who has been doing it for years and years was a California organization who kind of knew the system. And as you said, there are a lot of statistics about performance in the behavioral health system. My understanding is that the new company is from Texas, and they're not familiar with California. And I believe ours was done in June. It was a totally different kind of survey, and it did not focus as much on the performance statistics of, how the county is doing and things like, we always had goals in terms of reaching more Hispanics in our community and always looked at those numbers. Well, my understanding is those weren't even in there, so I just wanted everyone to be aware that the EQRO is changing significantly, and that's it. Yes.
Can you spell out the acronyms you're using?
I,
for those?
I can't remember. I just, this was
External
the
quality.
external quality review. Yeah. Yeah. And the only reason I knew about this was through a monthly meeting with the behavioral health director. We just had a one-on-one, asked, oh, how's the EQRO coming this year? And that's how I learned about it. So it's a big change. I'd have to get back to you on that.
Okay, and then the Welfare and Institution Code, the final duties are one, the Board of Supervisor can add additional duties if they want to. And then second, you are to assess the impact of realignment of services from the state to the county, to clients, and on the local community. And a couple of times in 1991 and in 2011, there were changes, things that were responsibilities and authority of the state. They changed the way that the funding worked and allocated the funding to the counties, and the authority and the responsibility also to the counties. So within that, usually you'll see realignment appear when you're getting a presentation on the budget, because realignment means money. So you'll see where that fits in, and it's usually, I think, around maybe 11% of the budget. So it's a substantive number, and realignment's used by different agencies, not just the behavioral health agency. Okay. In terms of the Behavioral Health Services Act, I spoke about that already when I was talking about the community planning. Oh, but let me go back to this slide because there's substantive recommendations mentioned here. So if you're going to vote on a recommendation on the approved or adopted Behavioral Health Services Act integrated plan, so the upcoming plan, you'll probably see a draft plan probably around March of this year. And that's not the plan that you're doing your substantive recommendations on. So you don't really have a plan right now to do your recommendations on. You can do recommendations on the Mental Health Services Act plan, your last update or plan for the Mental Health Services Act that was adopted. So you could review what that is, and if there were things in there that you wanted to improve, that's a good way to get your substantive recommendations in. Because that's still available to you, but since we're in a time of flux with the Behavioral Health Services Act, it won't be until after the plan is adopted that these substantive recommendations would be put into place technically. I mean, maybe the counties they may take your recommendations and try to implement them if they're early in the process. Say you get them to them within the next few months, they might try to implement that into the Behavioral Health Services Act integrated plan. But we don't want the boards and commissions to expect the staff, once they've come up with their draft plan, we don't want you to expect them to change it based on your recommendation at that point, because they're already at the point of trying to get it submitted and adopted by the Board of Supervisors and submitted to the state. But you're always going to be in a process of reviewing an adopted plan. So you continue to look at the plan that has been adopted and make your recommendations on that. So substantive recommendations on that plan, and you can do recommendations on a draft plan, but they're not called substantive if it's a draft plan.
It's on the beginning.
So once you have an adopted plan, if you have recommendations on it and your board votes on those recommendations, you have to have that item on your agenda. So the public knows you're going to be making a substantive recommendation on a Behavioral Health Services Act plan. If that passes and your board members support that recommendation, then a response is required by the Behavioral Health Agency. Either they need to implement that implement that recommendation, or they need to explain why they didn't implement that recommendation, and they need to explain it to the Board of Supervisors and the Department of Healthcare Services. And it's good for you all to incorporate that information in your annual reports. Also have your recommendation and the response in your annual reports, because that's a good document that we can, Cal BHPC can look at it, other counties can look at it, the state can look at it too, and understand why something was not implemented. What were the reasons? Was it budgetary? Even though the community really felt this was a top priority, they couldn't do it. What was the reason? Or what was recommended and put into place? That's good information too.
I have a question. So that we stay active with whatever this plan is or the revision of the plan, is it possible that on our agenda for the one that's in March or earlier, that we, not as an action item to be voted on, but to review as part of our discussion, just so that we can stay up to date, and it prompts us to know that in our own work that we did review it, but it doesn't have to be a vote, but something that we vote on, unless something substantial comes up, and then we'll have to add that to the
Yes,
next.
and you can, I say it's good to vote on any recommendation. It's just not, there's not a response required from the agency if it's the draft plan. But I think it's good to go ahead and vote on
And-
recommendations
Okay.
anyway.
To make it an action item, just
Right.
go ahead and do that.
Yeah,
Of
that's
San
a way to
Francisco.
know that your board is in agreement.
Right.
And then it becomes more of a statement of what you recommend instead of you. We want to get away from members just having a speaker and then throwing out recommendations at that speaker. That's just not productive. I mean, it could be part of a discussion, but we want you to be reflecting on what you're hearing in the meetings, and then over time drafting these recommendations.
So we have our Behavioral Health Services Director make presentations. Normally it's just, we ask a lot of questions, but I don't think we've ever thought to make those also action items. That is not just having a presentation, but if we're drawing critical ideas or making suggestions or asking for certain follow-up, it sounds like that should also be an action item.
Well, you know, sometimes if there's follow-up that you want from staff, you know, that's something that you need to have your chair and executive committee determine, you know, what are the priority areas? What, as a board, have you decided are priorities? You know, we don't want you in a meeting having to decide, okay, we want the staff to follow up on all of this.
No, we make
So,
that as a point
okay,
of the
right.
discussion to ask the director for further information or to get back to us on how certain services are being implemented and what their success rate has been. And maybe that should just be part of our agenda, summary of the meeting, or, you know, when our minutes, so that we do have that. Those are some very important from San Francisco, yes. Some
Yeah.
positive things that did happen.
Okay.
Okay,
Yeah,
we can.
I just, I guess I get concerned sometimes when I see in a county where the staff is getting badgered with questions and being told to follow up. When it's not, maybe maybe the group has not made that a priority area that they want to have responses to. So a lot of times when things come up in meetings, I would just refer it to the executive committee to decide what would be the response. Do we need more information from staff? Should we ask for another presentation and ask for a report on specific systems that you're interested in? Or do we want to do some research on our own? Do we want to do an ad hoc? You know, how do we want to understand this information?
What has been interesting, I think, in working with, we have a new behavioral health service director. So it appears that she does try to take our concerns into consideration when she does her presentation. So the issues that she is addressing are things that we have identified, and she wants to make sure she's aligned with what we're looking for.
Good.
So,
That's good.
thank you.
Okay. We have a slide here on some of our suggestions for reviewing and evaluating. And keep in mind that you are experts in your own experience, no matter what your experience is, if it's experience of having services in the past or currently, family member, or a provider, or somebody that's intersected with the system somehow, could be even as a business person, or, you know, could be somebody in law enforcement. But whatever your experience is, that's where your expertise lies. And we want you to tap into that, you know, and we want others to respect that when you're having discussions on what are the priority areas that you want to be advising on, and also what is okay, you know, what's okay in terms of what you saw at that site visit. You know, we want people's experience to help determine that and help you analyze. So on this slide, we provide some suggestions on what to do when you review, what to look for. One is accessibility. Is it culturally relevant? Is it scaled? Is it integrated? Say, you know, do these services need to be integrated in primary care places, you know, in places where people are when they go into a clinic, or, you know, is it integrated in terms of, are there ways for somebody that just got out of the criminal justice system and needs to access some behavioral health services from the agency? Are there good ways to get them engaged and involved in those services? Is it integrated that way? Is it communicated? That could be as simple as, are the signs easy to follow? You know, if somebody drives up to your behavioral health agency and they're looking for Maybe you have a crisis stabilization unit there. Do they know where to go? Because they need it to be really clear, especially if they're in crisis. Second, recommended practices, client and family driven. Care providers are an essential component. Clients and family members should be treated with dignity and respect. Program leadership and staff, it's great if they include people with lived experience and family members. And then we have recommended practices. The last two are evidence-based practices, which we have a listing on our website with some definitions, and then trauma-informed practices. Trauma-informed practices may be another one of those that there was an executive order telling us not to use those anymore. So, but we still have state funding. We can still use trauma-informed practices. Sustainability, is it financially viable? You know, we don't want to lose our contractors, especially if they're effective. We want to make sure that the funding is there for them and their workforce and their facilities as well. And then performance, looking at the performance. And this last slide just points to the best practices guide. And we also have a member guide sample, which we recommend providing to your members. You could give them the best practices guide. A member guide would be, you know, have some of the information that we have in our best practices, but also would have perhaps your bylaws, a roster of your members, a calendar of your year, that sort of thing, maybe a copy of your annual report. And then we have a lot of different pages for news and issues on our website. And performance information, resources, lots of different templates that have been shared by other counties that you can use. And then a number of trainings. The trainings that we're providing today are on the website. And then there's also ethics trainings. It's a 2-hour interactive training that is required for board and commission members. And then unconscious bias training, which we recommend. And we have a recording every now and then. We provide a live unconscious bias training as well.